fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr.Aimee.
She's known as the egg whisperer.
Fertility expert Dr.Aimee today.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, thanks for joining us for another episode of the Egg Whisperer Show. Tonight's episode is endometriosis, the craziest spring break in your body. So I have Paula, my producer here. Paula and I went to high school together in the 90s. We might be in our early 40s, right Paula?
Might be, yes.
And I also have director John here. So this is the thing. When I think about topics, I always think about how can I describe them to people in a way that they get it? So the way I think about this is I think about back when we were in high school and MTV Spring Break was like the biggest thing. I mean, just think about this. You have this beautiful beach, it's totally pristine, and then it's spring break, and then all these people just descend upon the beach and probably kind of somewhat destroy it. So that's kind of what endometriosis is to me. I mean, it's a cyclic event, and then cyclic would be like your period, where you have severe pain, and then once that period is over, you might not quite be the same. And then every year it might get a little bit worse. So what I want to do is I want to talk about endometriosis and teach you everything that I know about it that can improve pelvic pain and infertility. So imagine this, you have a job where if you were to give one person a message, it could potentially save them from years of heartbreak. That's me. That's what I want to do. Someone made this for me and I thought it was pretty cute. That is not my body, but that is my face. So as far as endometriosis goes, it kind of sounds like osteoporosis, mononucleosis, tuberculosis, but it's totally different, and I'll describe why. So if you have osteoporosis, you can go and get a very simple bone scan. A doctor can then give you a Z-score or a T-score and then tell you if you have osteopenia or osteoporosis. When you have mononucleosis, you get a blood draw, and then they can check for Epstein-Barr virus, and then they tell you if you have mononucleosis. And then when you talk about, what was the other thing I said, tuberculosis, and you're coughing and coughing, right, Paula? You just get a chest x-ray, and someone's like, you have this disease. Well, endometriosis is nothing like those things. Some studies show that it can take a woman up to 9 years to officially get accurately diagnosed. 9 years. And what you'll learn from the show tonight is that early diagnosis and treatment is key to preventing worsening pain and infertility. That's just very humbling. So we have many megastars and celebrities who've been very open about their struggles with endometriosis. One of them, most recently, and she's been in the news a lot lately about endometriosis, is Lena Dunham. 5 surgeries. She just recently had her 5th surgery. And she was quoted as saying, Paula, pull up that quote for us and read it to us.
Sure thing. She says, "My surgery went off without a hitch. When I emerged, Randy told me something I hadn't ever expected to hear, maybe ever. There was no endometriosis left. Between my surgeries and hormonal intervention, I was disease-free."
Mm-hmm. And we'll talk a little bit more about that. So she mentioned surgery and hormonal intervention and 5 surgeries. So another superstar, Julianne Hough from Dancing with the Stars. Endometriosis since 2008. That's almost 10 years that she's been suffering with the disease, and she is now coming out talking about it. And she has a great quote too, I think. Paula, what was that quote that she just shared with us?
She says, "I didn't want to complain, so I'd just deal with it and ignore it."
Yeah, and I think as women, that's sometimes how we feel. We feel like having really painful periods is just part of being a woman. You go to the doctor, or you even go to the emergency room, and you describe the pain, and someone just gives you a nice pat, pat, rub, rub, and then sends you on your merry way, and then you're left with nothing. No options, no diagnosis, no treatment. So I want everyone to find their person, their doctor, their team, and you find that person if you have endometriosis, and you stay with that person. And I'll teach you more about endo and how to maintain the symptoms and hopefully get ahead of infertility as well. Another famous rapper, Monica. I do think of myself as a rapper sometimes. My email address, this is kind of funny, is draimee@draimee.org. And you know when you're calling and placing orders for things, they're always like, "What's your email address?" And I just say draimee@draimee.org. That's funny. I thought it was funny. Kind of not a rapper. Okay, so how do you diagnose the disease? How? So imaging, laparoscopy, that's a surgery, and then blood tests. So this blood test is not available yet. I'm always trying to find the latest and greatest tests that people can do to get the very best diagnosis and then ultimately care for whatever they're going through. So this company, they're based in the Bay Area, has found a test in the blood that they can do that they say accurately diagnoses endometriosis. I really look forward to that test, becoming readily available. Another test is the CA-125 level. The problem with that test, it's a cancer screen. I don't like telling patients, I'm going to do a cancer screen on you. And that's kind of scary. And that causes a lot of anxiety. And the goal is appropriate diagnosis and treatment and hopefully a better quality of life. But that test is also a valuable tool. Based on that level, you can follow it over time. You can then use your treatment and see if the level comes down, if the treatment is working for you. So another test that you can do, we talked about laparoscopy, we talked about blood work. There's another test that you can do on the lining of the uterus. And I was recently quoted in this article about it, and it's through a company, Receptiva DX, and it looks at a marker that may be a very sensitive marker for endometriosis. But this is the thing, it involves a biopsy. Ouch, biopsies hurt. I don't like hurting people. So the way I do the test is after ovulation, 7 to 11 days later, you can come in for a biopsy after you've taken some pain medication. The other way to do it, if let's say you're planning an IVF cycle and you want to do other testing, like endometrial receptivity assays, you can also take medications and then come in, let's say on the same day that you would do a transfer, but instead of a transfer, you do a biopsy and you can send cells to both places. You can also do it under anesthesia and benefit from doing a hysteroscopy at the exact same time. So there are a lot of different ways to diagnose it. So find out your diagnosis. If you think that this is something that you have, find a doctor that will listen to you, not just give you a pat, pat, rub, rub, and say, it's just part of being a woman. Get early diagnosis, get treatment, and I'll talk to you more about the different treatments. So, stop. That's the thing. Periods are the enemy. In my line of work, periods are the enemy. Anytime someone calls and tells me they have a period, it's like, I literally do like the upside down smiley face. I'm just like, oh, that sucks. Like, we don't like periods. And with endometriosis, if there's ever a condition where periods are really the enemy, it's endometriosis. So imagine someone telling you, you're, let's say, 23 years old, oh, the treatment for endometriosis is pregnancy or menopause. But that's kind of true. But at that age, you're not thinking of, well, a lot of women aren't thinking of getting pregnant quite yet. And to tell someone at 23 that you have to induce menopause in them, well, that's kind of scary. So the goal is no periods. So how do you get no periods if you have endometriosis? Well, there are a lot of different ways. So you can take birth control pills, and it has nothing to do with controlling birth, but minimizing bleeding. You can take them in a cyclic fashion, which means an active pill every single day. You can take medications that are injections, GnRH agonists, and what we're learning more is that there's a GnRH antagonist that's almost FDA approved and will be readily available. So we have birth control pills, GnRH agonists, the brand name, one of them is Depo-Lupron, GnRH antagonist, not quite here yet, and then an IUD, one of the brand names is Mirena, but that's an insert inside the lining of the uterus that can cause amenorrhea, which means no periods. So that's how you treat endometriosis. Periods are the enemy. Every period you get equals worsening endometriosis. So anyone who has endometriosis knows exactly what I'm talking about. It's like someone's taking a knife, putting it in your tummy and turning it around and then taking it out, and then you kind of come out of it and then you're just bracing for the very next period. So I don't want anyone to suffer. I want you to learn these things because the earlier you treat it, it's still a horrible disease because, as Lena Dunham said, after 5 surgeries, she's hopefully disease-free, but it still can come back. So where does it come back from? Well, it comes back from the ovaries. So that's why menopause is the treatment. But in, let's say, a 23 to 25-year-old woman, you're not going to remove her ovaries, but that is a treatment that some women do choose just because the pain is so significant. So, if you're under 18, please stop watching. So, you can actually use cannabis-infused suppositories for pain. Is this FDA approved? Has this been studied by pain specialists? Absolutely not. And I'm not recommending this at all as a treatment for endometriosis. But what I'm recommending is that if you have this disease, don't just seek out, let's say, Western docs like me. There are other things that you can do. Not this, but I just thought it was something funny. But other things that you can do are acupuncture for your pelvic pain. Okay, so more along the lines of treatment is diet and fitness. So I told you how low estrogen states, no periods, is a form of treatment for endometriosis. Well, an anti-inflammatory diet can also help. So this is a book by Dr. Cook. He's also a local physician that I recommend to all my patients with endometriosis, and has a really nice diet plan with supplements in it that you can learn more about. And then the other thing is working with a nutritionist. So sometimes it's not as easy as just looking in a book. You can actually work with a fertility-minded nutritionist who will talk to you and individualize a plan for you. And so I just put this website up so that if you want to reach out to Judy Simon, she's wonderful. She's a nationally, if not internationally acclaimed nutritionist who knows not just endometriosis, but also working with women with fertility issues, women and men, and also PCOS. So I just wanted to bring that up as a resource. So while I mentioned a lot of pharmaceutical ways of treating endometriosis, like the pills and the shots, well, you can also use foods, like I mentioned, as treatment as well. So here's a list of supplements, and I know it's a really long list. I'm going to pull up the list in front of me so I can read off of it. But if you're a patient of mine with endometriosis, a lot of times I'll send you this list, and it's a lot of stuff. But basically, I just go through the literature, I look at different studies, and then I get feedback from my patients, and I say, has this worked for you? And I know that's not an official study, but none of these things will hurt any of my patients. So NAC, N-acetylcysteine, licorice root, a good prenatal with DHEA, Vitex berry, or just resveratrol, organic muscadine grape, calcium, magnesium, vitamin D3, maca, and turmeric. So I put patients on a schedule, I tell them where to get it, and then these things can decrease inflammation and hopefully help with your pelvic pain symptoms, minimize the disease, and improve your chances for a really healthy pregnancy and the least amount of heartbreak possible. So the other thing that Lena Dunham has done is she has gotten into the best shape of her life. And people shamed her for losing weight. But for her, it was very, very important to lose weight. So there hasn't been a study done that has taken, let's say, a group of women with endometriosis and split them up into two groups, exercise versus not exercise, and then looked at their symptoms. But there have been studies looking at, let's say, women in general who exercise, and then if their symptoms improve. And it seems like while exercise can decrease estrogen, it is actually a very good treatment for women with endometriosis. So exercise lowers estrogen. That's a known fact. And so if you have endometriosis, working with someone who can put you through a very rigorous exercise program is actually not a bad idea. Obviously, when you're in a lot of pain and you have the symptoms of endometriosis, especially during that spring break, when all the spring breakers are coming into town or your period's there, well, that's not a time that you really want to be working out, I'm sure. So I want to close out tonight's show by seeing if we have any questions at all. Paula?
There's a lot of chatter on Facebook.
Okay,
but
tell us.
I don't see any questions.
Oh, that's okay. That's okay. Well, my goal is for everyone to keep calm and get ahead of infertility. And I hope that if there's just one thing you learned tonight, it could be about getting an ultrasound, asking for appropriate diagnosis and treatment, and getting your levels checked. Get your levels checked, get your levels checked, get your levels checked. Have a great night, and we'll see you here next week. Good night.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility